Let me introduce again the panel. I will go in Greek. Ο Γιώργος ο Καλατζής είναι πλαστικός στο Leeds, consultant πλαστικός. Ο Στέλιος ο Γεωργούλας, κατά σειρά βλέπω, κατά σειρά όπως βλέπετε. Ο Στέλιος ο Γεωργούλας είναι consultant στο Cambridge, στο Addenbrooke's. Η Άρτεμις Σιμάτσα είναι στο East Grinstead, στο Λονδίνο. Ο Σπύρος ο Πίπης είναι very aspiring, ready to become a consultant και θα πάει στην Κύπρο. Ο Σπύρος ο Πίπης. Ο Μινάς ο Γεωργόπουλος είναι ο πρώτος Έλληνας που πέρασε εξετάσεις στην Ελλάδα και θα πάρει αύριο το βραβείο Γρηγόρης Γεωργαρίου και 4 χιλιάρικα. We give 4,000 for our first candidate. I think we surpassed the college. And last but not least είναι ο Πάνος Γεωργουδής, ο αγαπημένος μας Πάνος, ο οποίος είναι στο Whips Cross, είναι κόρνεα, κάνει κερατοειδή και όλοι τους είναι τρομερά παιδιά με διαφορετικούς δρόμους, με την ίδια κατάληξη και όλοι high aspiration Έλληνες γιατροί. Είμαστε πολύ περήφανοι για εσάς παιδιά, σας ευχαριστούμε πάρα πολύ που ήρθατε και είναι τιμή μας που σας έχουμε.
So if we can just have a word, everyone will tell us their experience and how they entered the specialist register, how you became consultants in the UK. I think we can use the mics there.
All right, so can I speak in English, Greek? What would you prefer?
Please, that will
help absolutely, me. Absolutely. So, okay, I'm the most senior in the panel because I've been a consultant in Leeds since 2012, so it's more than almost 12 years. I entered the GMC in 2003 when there were no requirements like today. So all I had to do is just to send my passport, my medical diploma, and that's it, because EU was part of,
So at that stage, were you a specialist in Greece?
No, at that stage I was just a medical doctor. I've qualified as a medical doctor, and in order to get to the GMC, on the register, not on the ophthalmology register, but just to get on the GMC, all I had to send was just my medical degree, diploma, that's primary qualification, and my passport. I didn't even have to go to the GMC in London or Manchester and go through an interview. It was very, very simple. So I passed the MSc Opt 1 because at the time there was MSc Opt 1, MSc Opt 2, it was completely different structure of the exams. And I had to do an allied specialty actually before getting into ophthalmology. That was the main requirement. So I had to do a neurosurgery. And then I did a year and a half in Bristol Eye Hospital as an SHO, because at the time there was SHOs, registrars, SPRs and so on. Then I came back to Greece, did another 4 years of training, and after completing my training and passing the Greek exams, I automatically get on the ophthalmology registry, as you very rightly said. In the past, since I was from the EU, that was sufficient to get on the GMC registry. And in 2009, I did almost 3 years of fellowships, Leeds and Moorfields, as oculoplastics, Lachman and Orbital, and then I got the consultant post in Leeds.
So at what point did you enter on the specialist register?
In 2009, once I passed my Greek exams, my Greek ophthalmology exams.
So all you had to prove is that you were a specialist in Greece?
In Greece, and I was an EU citizen. These were the two only requirements at the time. And I've mentioned about the GMC because things have changed a lot now. You can't simply send your passport and your MD and then you'll be automatically get on the GMC. It's a completely different process, and my colleagues will explain that. So what I'm trying to say is that things have become more complex as the time goes by. Mind that the consultant post requirements are still the same. I mean, you still have to show fellowships, you still have to show your competencies.
Yeah. So this is actually a very important point, just to be able to differentiate between joining the register, so the GMC would say, yes, this doctor is qualified to work as a consultant, and actually getting a consultant post. Because it's a difference between the register and the actual market where you go and apply for interviews and compete for a post, because it's completely up to the trust, the NHS trust that you're appointing to, whether they take you or not. You agree, yeah?
Absolutely, and I think also we have to differentiate between tertiary referral centers or university hospitals compared to DGH. So it's completely different because the requirements are quite different. So, for example, I went for sort of a mock exam to see how things are on a DGH, and they were not interested in my publications or my PhD or whatever. The only thing they were interested in were the numbers. While when you go on a tertiary referral center, you definitely need to show some interest in research and education apart from the service providing
So
part.
you've spent quite a few years from the point of entry until you got the consultant post. Do you feel that these years have actually helped you to become the consultant you are?
Absolutely, and I think that the fact that I did a year and a half in UK and 4 years of training in Greece, which is almost 5.5, it was much better than do only 4 years of training in Greece, because the ophthalmology residency in Greece is only 4 years. So that helped me a lot. And in addition to that, the almost 3 years of fellowships was really crucial for me to be able to be to a high standard level in order to get a post in a tertiary referral unit.
Yeah, so there's nothing against in starting in a specialty and then moving into ophthalmology.
No,
Yeah, it's
definitely
all
not.
transferable skills, aren't they?
Absolutely.
Thank you very much. Yeah.
Okay.
Hi, I would like first of all to thank you, Mr. Aslanidis and Mr. Haidoulis and all the rest of the OMMA organizing committee for inviting me here. I have a bit of a kind of a weird pathway. I started from a very small town of Greece under the name Trikala, from a non-medical family, graduated from the University of Thessaloniki, and then the day that I graduated, I left to United States. I started my research there, and then during my research, I applied for a PhD at Moorfields Eye Hospital, and I did my PhD at Moorfields for 2.5 years. But I was quite curious about how the world was working, the world of ophthalmology, and I left after finishing my PhD in 2.5 years, and I did a program of management and leadership at the London School of Economics. It was a good year where I understood that I loved ophthalmology a lot, because during the PhD it was quite hectic. I was working sometimes like 20, 22 hours a day, and it was very, very demanding, and it was a full-time job. And this is when I applied for the London training program. And I was very fortunate to be very, very lucky and very fortunate to be the only non-UK medical school graduate to get entered to the London training program. I was also very lucky with my placements, because by the end of my specialty, which was 7 years, I had done 1,500 cataracts, and also had done a lot of other things, because I was quite lucky with the placements that I had. And on top of this, I did 3 years of glaucoma training, 18 months in pediatric glaucoma and 18 months in adult glaucoma. It was a beautiful experience. I want to disagree a bit with your slides. It's not a well-paid job to be a trainee in London. You live in real poverty. Because
at any stage.
At any stage. And I think when you become a consultant, actually you get paid much better, especially if you do private practice, because you're very aware of what is happening now between the BMA and the government, and they're trying to change the whole remuneration of the consultants. But it's very challenging, because not only you're working like a dog, you are working, you have to pass the FRC Opt exams. And I will not forget that for 2 years, because this is how much preparation it took me, I was hidden in a library where I was finishing work at 6, 7 o'clock in the evening, and hiding in the library by midnight in order to be able to get the knowledge that was required to get this exam done. So all I'm saying, it's a beautiful pathway, because I think the UK has the ability and has the know-how how to create directors of clinics, how to take responsibility of your cases, sort out patients, run clinics very, very efficiently, and make patients happy. And vision is very important. But we don't only talk about ophthalmology, we talk about every specialty. But it's not an easy pathway. Lots of opportunities are given for European people. Few things are changing because Brexit, but we don't know what future brings. And as you said very correctly, there are many jobs. But I want to make a bit of a side note to that. The best jobs are not available for European candidates. It's the jobs that cover certain needs of the service. For example, injections for medical retina, to do glaucoma clinics. If you want the top-notch jobs, you have to have been trained fully in the UK, in my opinion, or you have to have been there many years after coming from another national system to know how the system works, to have had the great experience to work with people to know you in order to give you opportunities to work in the best hospitals.
So a couple of points that I'll pick from what you said and just, so you still practice in the UK?
Yeah.
So after all these years, it became lucrative at some point. The effort you've put has paid back.
It becomes lucrative when you start private practice. This is
but that's because you've trained very well.
Not only that, but also because I work in an area in Cambridge that is quite affluent.
Okay.
So, and there is a lot of need for glaucoma and a lot of need for operations, cataracts, refractive.
Well, the need of glaucoma is everywhere now.
Yeah, but I mean, I don't know how things work, but I believe that in our area, it's a very good market. This is when it kind of becomes lucrative.
And when you started telling us your experience, you said that you were from a remote area in Thessaloniki?
No, I was like from a small town of Trikala, but I graduated my medical school from Thessaloniki, which is one of the good medical schools of Greece.
So does this mean that depending on where you qualify as medical graduate in Greece, you can get different experience with your training?
I think the medical schools in Greece, all of them, are pretty good. And actually, I think that are actually very, very good compared to medical schools that I compare.
But ophthalmology training in your area?
Ophthalmology training, I'm not the person to tell you where. It's a waiting system, is a different thing about how you get training in ophthalmology in Greece, but I'm not the person to tell you all this.
Right. Well,
but in order to get into the GMC, immediately, this was sorted out with me by Moorfields because this is where I was doing my PhD. So they registered me immediately to GMC, and the registration for the specialist register just happened automatically after I finished my training. So, but I think Greek doctors are very well trained from the medical schools. That's why you see that Greek doctors are thriving in many parts of Europe and the world. Because I think the Greek schools, although we criticize them that they are bad sometimes, they actually prepare you with a lot of knowledge on how to cope with chaos, how to obtain depth in knowledge. And I think these skills are very important to survive in the NHS. That's why you see so many people doing so well coming from Greece. I mean, you know that there are hospitals in the UK now that they have meetings in Greek. The same happens in Sweden. The same happens in Germany. Greece trains more doctors than it can absorb. But also I think that Greece trains, in my opinion, good doctors as well.
In the medical school?
Yes. I mean, it's the start of the journey.
Start of the journey.
But
Okay.
the UK is amazing on the specialty side. And the way that the Royal Colleges have structured the training together with the schools is amazing because you have clear targets what you need to achieve. And what I like is when a trainee fails, which is possibly not what is happening in Greece, when a trainee fails, the college doesn't blame the trainee only, blames the trainer as well. And they are looking at the whole picture. They say, how we can support this trainee better. And they change the trainee hospital, rota, and then they see where is the problem. And I think this is beautiful in the UK.
Perfect. Well, thank you. We'll end that on a positive note.
Of course,
and then,
always.
Sorry, Mr. Georgoulas. Can I ask you a question?
Yes.
what was your PhD on, and how did you decide to go to Morpheus to do your PhD?
It was a matter of luck because I applied for. I was homesick in New York. I had a good
In New
time.
York.
I started in New York INTR in Infirmary. I was working with Bob Rich and then with Thomas Muldoon.
Right.
So they invited for a guest lecture Professor Penko. And I had a few discussions with him. He said to me, "Oh, why don't you apply for a scholarship to come to UCL?" And I was a bit homesick. I want to be in Europe. So I applied for a scholarship and I got a scholarship.
So it was funded from
My
from
PhD
UK.
was fully PhD was fully funded by Moorfields, and I stayed in Moorfields in total for like 2.5 years for my PhD and 5 years for my training.
And
3
what
years
was the subject of your PhD?
was wound healing after glaucoma filtration surgery.
Right. So it was lab based.
It was not lab-based only. I was doing a lot of clinics because we're trialing. I had one of these positions where we're trialing new medication to people. And also I worked during my PhD with 5 pharmaceutical companies, and I did a lot of in vivo work with operations in animals. But this helped me a lot when I started my training, because when I started operating, and I had already done 150 trabeculectomies, and I had put 120 tubes on animal eyes, then it was very easy for me when I started doing glaucoma surgery to cope with this.
Great, great. Just to make junior doctors listen to all of this and to get them know that there are different routes how you can start your career in ophthalmology, especially, and how successful you can become at the end, starting by, vice versa, because usually you do your training first and then you do a PhD or something else, a higher degree. But yeah, you can do it the other way, or you can do it parallel ways.
The college now accommodates trainees who would want to take time out of program to do PhDs, and their place will be kept for them so they can come back.
Absolutely, they don't lose their position. And also it's very important, it's very good extra qualification, having a higher degree on top of your FRC if you want to become a consultant in one of the top hospitals.
But I want to tell you, I want to be frank with something. If I hadn't done my PhD with the guy that I did my PhD with, because Penk is a very powerful ophthalmologist, and if I hadn't done also the Masters in Management and Leadership from the London School of Economics, there was no way that I was going to be able to compete with the people who were going for the London training program. So I was I got the right advice from people for the pathway to start this. And don't forget, I started my training quite later than other people. So when I got into ophthalmology, I was 29 years old. My colleagues at the same time was around 24, 25, 26, so they were younger, because they had followed the British pathway. They had done the medical school, they had done the foundation years, and they had entered immediately for training. So definitely there are different pathways, but when you go as a Greek in the UK, you have to play the game in a bit of a different way. And you need to know the scoring table, what are the things that are going to get you the points, and where you can compete with excellent British candidates. And this is how you can kind of win the game.
Okay.
I would like to make a comment on this myth for the youngsters. There is no need to think about what age did you start your residency at. The final pathway leads to a port, and this port should be safe and sound.
It's never too late.
It's never too late.
At any point.
I would like to stress upon the fact that the average age of the median age of the first-year American medical student today is 30 years old. So they first go, they do pre-med or do something else, they go out and they work, and they realize that, no, that's not for me, because sometimes you are very young enough to decide at the age of 18, 19 that you want to have such a long and demanding career. That's number one. Number two, there are another 250 people attending this session online. So we thank them we thank them very much. And I think Artemis is next.
Yes, Artemis, the only lady,
The only
on the
lady,
panel.
yeah. So,
And sorry, before you start, I want you to just to answer a comment that you haven't been in the UK for many, many years, and you are actually a consultant in one of the, if not the top cornea unit in the UK. So your job was actually very, very competitive. So if you just tell us how you got it.
true. So first of all, I'd like to thank Mr. Aslanidis as well for inviting me here. And second, apologies for my voice. I know it's terrible today. So yeah, my journey is also a non-standard journey in ophthalmology. My colleague Mohammed Al-Alfi knows it very well because he was in the panel who appointed me for my fellowship at Queen Victoria a couple of years ago. So I started, well, as Tayo said, I also graduated from Thessaloniki, and then I immediately left to the UK. So I did my foundation training in West Midlands, and I followed a slightly different path at the time. So I went into core medical training. So all the exams that you heard about Royal College of Ophthalmologists, I've done the exact same for a different college, the Royal College of Physicians, because at the time I wanted to become something else. Anyway, so once I thought about my future and my career and what I really want to do, I decided to return to Greece, and then I completed my residency training in Thessaloniki. During these years, I maintained my GMC registration, so that goes a while back now. And it was much easier in a way to return back to UK when I wanted to for my fellowship training. So my return back to UK was quite smooth for me, I have to say. That happened in 2018. I started with fellowship training in oculoplastics initially, then Cambridge, where I met Staios as well. I did a cornea fellowship there, and then at Queen Victoria Hospital. And as Mohammed just mentioned, through my very competitive fellowship at Queen Victoria Hospital, I proceeded to get a consultant job in a very competitive department. So yeah, not a standard path in the UK. Obviously, things may have changed since I started my journey, because as I said, it was quite smooth for me because I started my training in the UK a few years back. I have to admit that the training, we have to embrace the differences between training systems, and Greek training system, I think most of us know the pros and cons of it. But when we talk about the UK, the British training system is a very structured training system. And I think it's a great opportunity for young ophthalmologists to hear about the process of how they can enter that system and how they can get those opportunities as well. It's not easy. I mean, for British trainees, it's kind of like a no-brainer how they're going to proceed through step by step through this journey. But for a non-UK doctor, that's very difficult. And I have to praise Mohammed Al-Alfi as well, my colleague, because he's doing a lot of guidance and he's helping a lot of non-UK doctors, not just from Europe, but from overseas as well, how they can get into the system, or even how they can get some qualifications in the UK so they can proceed to higher roles there as well. So I think this is a great session for young ophthalmologists in Greece to hear about all that. There are a lot of positives in the training system there, and I think we all know those positive aspects, like the surgical training, the training environment in general. There is a very different culture and a very supportive system for training. Now, when we go beyond the training system and how you can then proceed to higher roles, so fellowship training, a locum consultant or a consultant job, it becomes a little bit more tricky. It's very competitive. And very competitive because, I'm seeing that from the other side myself. As a consultant now, I'm also participating in fellows interviews and shortlisting, and it's extremely, extremely competitive. The kind of CVs that come in our hands are crazy. You see ophthalmologists from all over the world with amazing CVs. It's extremely competitive to enter the system at that level. And I think the preparation has to start from much earlier in your careers. Obviously, things are changing in the UK as well. I think the college is doing an amazing job in trying to protect the safeguard the way surgical training especially is offered. For example, cataract surgery, as we all know, is a little bit of a topic for discussion even in the UK at the moment, but the college is really fighting the corner of the trainees, and that's also extremely important because the trainees are not just there by themselves trying to get the kind of like qualification and skill set that they need. They're being supported in that, and fiercely actually so. So I think that's a big benefit from training in a country with a structured way of training and with supporters of your training. What else? I mean, in terms of consultant jobs, that's another discussion I think to have. It's very difficult to get a substantive consultant job in the UK. Obviously, depends on the subspecialty that you're going for. I think, well, as just to kind of like continue with the previous discussion, that at least when I applied, or when the period of time that I was applying for jobs, I think the requirement was that someone needs to have FRC or equivalent. That was on the job description, on the essential requirements, if I'm not wrong. So it wasn't FRC alone, it was FRC equivalent, but as I hear, probably that will change soon. In terms of the specialist register, as I said, for me it wasn't, it was quite smooth in the sense that I already had like previous degrees, like I was already part of a college, and I had my Greek CCT recognized and acknowledged in 2018 in order to join the specialist register, so there wasn't much of an issue at the time, but I'm sure things are going to get more difficult. So because of this change, because of Brexit and the change that brings, anyone like young ophthalmologists from anywhere in Europe or beyond, considering doing the FARSI exam is probably a very good idea at some stage.
Well, thank you, Artem. It's just a combination of the two experiences. If you want to have a top job, you will need to work hard for it. If we're talking about a brilliant training system, this will not run if the consultants are not on a very high level. So it goes without saying. And certainly there's difference between DGH places when you get a job, or teaching hospitals, or tertiary referral centers, that's for sure. So it doesn't matter how much you invest in yourself, there is always a route to qualify and subspecialize in the UK. Thanks, Artemis.
Hello. I would like to thank Mr. Aslanidis, Mr. Hayadoulis, and Mr. Tatisseris for their invitation. My pathway as well has come from Greece, so it's been a bit more troublesome than an average UK trainee. My initial training started in Cyprus. I always had the drive to finish as early as possible because I had to do a compulsory 25 months in the army. And always I wanted to come in the UK. So I registered with the GMC in 2015 at the point where the British exams for language just started. So we had to pass IELTS to register with the GMC. At that point, I wish I had someone like myself to ask what's the next point, because I had already completed a bit of training in Cyprus, but didn't know the right pathway to enter the ST3 jobs back then, or the ST1 requirements, and pretty fair, the website was chaotic at that point. So I decided to finish my CCT and come as a post-CCT fellow in the United Kingdom, which I started my glaucoma fellowship in London in 2018. We were not in position to compete the UK trainees, I would say, because you come with a 4 years training experience competing people that have done 7 years. And despite me being lucky enough to have come in the UK with a good number of surgeries, you do not know the system, how it works, how it functions, how you need to, let's say, come across with different situations you will find in the NHS. So my pathway was to do as many fellowships as possible. I think I'm the probably I hold the record of fellowships, 6 years fellow. So I've done fully trained in glaucomas. After London, I went to Birmingham Midlands Eye Centre, and I stayed there for an extra year and a half doing glaucoma, and then I switched to cornea and anterior segments. So for the last 2 years, I have been doing cornea. On the meantime, through my training, I've done a master's degree and a postgraduate diploma, and only once I left Birmingham, I started having people offering me jobs for substantive glaucoma post at that point. So if you work hard enough, then the work goes out about, you know, consultants are few, are not as many in the UK, so they keep talking for good candidates, and then you can't really be offered nice jobs. But yeah, that's my pathway at least.
Thank you.
And it's sad not to see too many young ophthalmologists here, because really, they're like, okay, yeah, cool.
Okay, Minas, I'll be interested to listen to what you're going to say, because after you've become a consultant in the UK, decided to drop everything and come back to Greece.
First of all, thank you for organizing, guys, and thank you guys for being here. My first comment would be about the Brexit thing. I mean, I find that a great opportunity of building bonds and making them stronger. Greek ophthalmologists and Greek doctors have always been a part of NHS and GMC for so many years now, and I really enjoy seeing you here, and I think this is going to become better and better over the years, hopefully. The second very brief thing, if I'm allowed to say, so my process was a bit of a hybrid of what has been here so far. But I don't want to bore you with my FTSDA training or LAT years. I mean, I don't think that those posts exist anymore, these fixed-term specialty training or LAT posts. So I got my CCST in 2016, and by that time it was the FRC Opt or equivalent option to apply for a consultant job. However, I did 2 more fellowships. We were fellows together. I think, if I'm allowed to add to what Spiros just mentioned, in my opinion, the fellowship years are the best years an ophthalmologist can have. I mean, the amount of experience, interesting cases that you do get, the training that you do get in England, particularly in big hospitals like QVH, are amazing. I mean, you will get to learn so many things and improve your quality as a doctor, as a surgeon, to extreme levels. And then I became a consultant in 2018. If I'm allowed to make a comment on what Elias said before about lucrative thing and in medicine, you know, making money in medicine, it's in private practice, not only in England, but that's everywhere, right? So I'm not going to comment too much on that. Being a consultant in the UK, it's the continuation of what happens during your training years and during your fellowship. It's a structured job overall. It's not only a structured training that takes you there. You do have the support from a lot of bodies, like the GMC, your local bodies, NHS England, so many things that will help you with so many administrative medical issues that will make you a better clinician, a better manager, and you will enjoy this trip. It was personal reasons why I had to leave my consultant post over where I was extremely happy. As you know, I was covering alongside with Koch, really, a huge amount of glaucoma patients in the south. So I was doing what I knew to do best. But, you know, family comes first.
So reflecting back, would you do it again?
Of course, of course.
Yeah? You'll come, you still go to the UK and have the experience.
No questions asked, yes. I mean, it is a very enjoyable, very hard route. I really enjoyed that I shared that those essays in part 1 are gone now, because they were terribly difficult.
So you just passed the exam recently, so you have gone through the FRC of Throat, although you did not need to do it. So why?
Well, it's never too late to start medicine. It's never too late to start ophthalmology. And you never know, it would be never too late to go back in England one day. And if you make it obligatory, why don't I have
Did it add to your knowledge, your skills when you went through
Absolutely.
everything? Because now you're studying at a higher level. You already have your experience under your belt, and you're looking at books with a lot of depth of practice that you have. So you still felt that it has...
Well, as you know, being a fellow and then a consultant means that, for instance, in glaucoma, you're essentially a trabeculectory or a tube machine. You just do the same thing again and again and again. And then you realize there are so many other things in ophthalmology that you haven't used for so many years. I found that a great opportunity to remind myself what a squint is or what a ptosis is. It was quite enjoyable.
Very good. Thank you. Panos.
Before we proceed to Panos, I would like to acknowledge George Vakros. I don't know whether there is, you have made any arrangements to come up through, because he had the virus. Oh, that's it. Okay, George Vakros, and then we'll finish off with Panos. George Vakros is the counterpart of our guys here because he finished all his schooling in the United Kingdom. His medical school, his residency, his post-residency qualification, his FRCOF, and so forth. So, Yorgos, let us know your journey.
Sure. I hope you can hear me well. Can you hear me? Can you hear me? Do you hear me?
We can hear you now.
I'm not sure if you guys can listen to me. I don't get any feedback if you guys are hearing me. I'm going to start by saying that I went to the UK in 2005. I entered through examinations from Cambridge. Thank you, you can hear. Yeah, I entered through examinations from Cambridge. I did my A-levels here in Greece in a British school. And then I entered into the University of Aberdeen, which is in Scotland. I did my medical school there. It was 5 years. And as a European back in the day there, I could study for free. I didn't have to pay any fees. In contrast to England, that it was changing at the time. So I did my 5 years of medical school there. And then in comparison to all the other colleagues here that spoke, the GMC came to us. We didn't go to the GMC. They came to our university and they registered us for the Foundation 1 program. And at the time, it was guaranteed that you're going to get an entry into the Foundation program, where later on this has changed. So I did my Foundation program in Scotland as well, because early on we were informed that, you know, if you're gonna do something, you have to have a purpose. And one thing that most of my colleagues there haven't mentioned so far is the importance of having a mentor early on in your career and somebody who can guide you through. So I was lucky enough up there to meet Professor John Forster, who is well known to most of us by a book that we are required to study for part 1, and also Professor Augusto Blanco, who is now at Northern Ireland. Both of them, they advised me that, you know, ophthalmology is difficult to get in. It used to be difficult, it continued to be difficult, and it's still difficult. But you need to have a purpose, whatever you do. So in the Foundation program at the time, we had ophthalmology as part of it. Therefore, I managed to stay in Aberdeen, and I did my Foundation there for 2 years. 1 year I went to Inverness, Shetland, and Orkney. And the second year I was in Aberdeen, and I did my ophthalmology alongside these people. And then I applied at the time for the run-through. It was at the early years of the run-through program. in comparison to what I've heard so far, being a British graduate from a university does not guarantee you're going to enter easily into the national training scheme. And in fact, the first time I applied, I didn't get it. So I had to do something useful in order to help my career. And based on what my mentor said, this is when I did an MSc down in UCL in biology of vision, which it was a fantastic course. I got to meet a lot of great people, very big researchers in the field of ophthalmology through Moorfields and outside as well. And then while I was doing the MSc, I applied again. And again, the same story. I was, in fact, unappointable the second time, because back in the day, there was some stations that they were considering if there was any concerns, you wouldn't move onwards. So the second time, I didn't manage to get through. So then I did a research fellowship in Birmingham and Midland Eye Center alongside Professor Philip Murray, who is now retired, and Professor Cy Rose, which was a phenomenal year. It was very, very helpful and very, very useful. And I've learned also at that time the value of locums and how much you can earn by that, especially in an eye casualty setting. Bear in mind, I had no ophthalmology training. I only picked up what I did from foundation year 2. I managed to slowly build up, and I was able to run alongside with my consultants clinics of highly specialized patients and did locums, and in fact I managed to get my first car there, which of course it wasn't a BMW or something like that, it was more of a humble Toyota Yaris, but still through the locum money that was. So there is a room for that there. I wanted to foolishly prove a point at the same time that I could get into the ophthalmology training without doing the FRC of Part 1. For some reason, I don't know why I had this belief anyway, but I managed to get into ophthalmology training when I was doing this year, and I was the last person ranked in the North London Deanery. And then I started my run-through program there, which it was 7 years, in satellite units, and the higher years I spent them all at Moorfields Eye Hospital, where afterwards I did my subspecialty training in VR surgery there as well. And once I finished that, then I decided for family reasons to return to Greece. The exams is something that at the time of the training, it sounds like a hurdle and a pain. But in fact, as you acquire more clinical knowledge, you find that actually it comes a bit effortless. So for example, when I got into the ST1 training and I had to do my FRC of Part 1, it actually suddenly made more sense. MCQs questions about biometry, which beforehand you knew about it, but you didn't know about it at the same time, if you know what I mean. And then later on the refraction and all these things started falling into place because you are ending up doing refraction in the clinics. And then when you do your Part 2, for me, in fact, the OSCE, I always thought that this should not be a difficult examination because this is what you do on a day-to-day clinical basis. The only difference is you don't see ocular hypertensions or, floaters one after the other, 20 people in a row, whatever, but you actually see pathology one after the other. And it was before the COVID period, so we were actually examining real patients. And the OSCE, in fact, was, it was, for me anyway, it was a very easy exam because it was just an everyday clinical practice. So, but I do believe that the UK training system is extremely structured. As a graduate of it, I think it makes you a very well-rounded ophthalmology, including the surgical aspect of things beyond your subspecialty. Because at the end of the day, if you're going to do only your subspecialty, fair enough, you don't need anything else to know, but I've always admired, and I remember from early on, I've always admired those consultants that not only they knew their field, uveitis or VR or glaucoma, whatever it is, but they also were not afraid, for example, an oculoplastic surgeon to take a lens and look at the fundus and give a provisional diagnosis, whatever that meant. So the UK training system is giving you that opportunity and that ability. And in fact, when you finish whatever subspecialty you choose to do, at least you will have a basic understanding and knowledge of what the, every aspect of the eye kind of has. So the exams help a lot. It is something that if anybody wants to come to the UK, I would definitely recommend starting early and doing these exams, because you have to go with what the other candidates have. You cannot compare yourself with other candidates if you don't start from the same basis. And okay, UK medical schools are different from the Greek medical schools. I have no experience with Greek medical schools, so I don't really know, but I can tell that I've got other members of my family who are doctors, and I can tell the differences in how the UK medical school training is versus the Greek medical school training is, and how you need to learn the system if you want to get into the national training scheme from the beginning, or if you want to compete for a fellowship. Yes, Brexit has made it difficult. You need visas, you need all these things. I mean, Mr. Alalfi very well has given you all the information regarding this, which is fantastic. And I think whoever decides to come to the UK, it needs to know the steps, as Mr. Alalfi also said as well. You need to know your dates. That's a very important thing, because the recruitment dates work on a different time zone, if you, in a way, from Greece, like everything starts in August, every rotation pretty much starts in August, and the date starts September, October, early on for applications, etc., etc. So you need to bear that in mind if someone wants to go down the road. So that's pretty much all I want to say, and I'm happy to take any questions. I'm sorry I couldn't be there with you today due to a flu. I don't want to spread anything around, so sorry about that. But thank you for the invitation, Mr. Aslanidis and the OMMA, and I'm happy to take any questions.
Well, thank you very much, and we just, if there are no questions, we can move to Panos.
Right, well, thank you very much for kindly asking me to be in the panel, which is great. Thank you. It's great to see people I work with, Mr. Aslanidis, of course. I worked with him very closely, did my refractive fellowship with him in Crete. And the team here, quite a few people from Queen Vic, and people I've worked with. So thank you very much. My path is, again, like similar to my colleagues. I think is a mix of slightly more convoluted than the standard training. So I've been in the UK 20 years. I started my first job. It was a locum post. I had some experience from serving in the Navy as an ensign. So I then did my SHO jobs, and then I'm not going to go into great detail like Minas, some fixed-term training posts. I did sit my exams. I did my part 1, part 2. At the time was MRC off, part 1, part 2, and then part 3, which was actually a requirement before you could proceed into the training. So I've done all these exams, which was amazing at the time, because as many of you have said, the things that you don't know that you don't know, so you read them in the books, and then you start seeing them in the clinical practice, and then this helps you kind of build your confidence. At least it did at the time when I was quite junior. So it gives you that basic, a more than basic set of knowledge, and also you know that at the time when you said that someone had the MRC off exam, you knew that this was the standard of knowledge that was there. Be it your consultant, be your registrar, your senior. What then I did is I was doing this fixed-term registrar jobs, and my educational supervisor at the time was in Bristol, said, well, you've got your MRC off, you can do your Greek exam, you can do your exit exam, and then you can carry on doing your fellowships. So I got signed off for all the subspecialties. I sat my Greek exam. Then I entered the specialist register, which I've been since 2011. And then I did a medical retina fellowship in uveitis. Then I started my corneal fellowship. Then I did corneal fellowship at Queen Vic for quite a while. Then I went to Crete to do my refractive fellowship with Mr. Aslanidis. And then I went back in the UK as a locum consultant initially, and then I got a substantive post as a corneal consultant in London at Barts Health. And I've been there since. I'm training lots of trainees. I have STs in my department. We're linked to the university. We have fellows. Frequently we have fellows from Greece. Spiros was a fellow with us. So you see, my path was also slightly different. I sat the European exam as well. With regards to the exam, I think it's useful if you can sit the exam, because especially with the structure it has now, and if you want to work in the UK, but not only in the UK, even in Greece as well, it gives you not just the clinical knowledge, the experience, it gives you the confidence, and also it teaches you other things. If you looked at the curriculum, there are other things there as well. It talks about, properties, how you speak to the patients. You're looking into things like how you practice evidence-based medicine, how you can go about doing research. You've got all these resources that are available. And I think if you could sit the exam, it is very useful. One thing about the passing and failing the exam, in Greece there's very much a thing that, we're taught not to fail. Or, what do you do? I failed the exam. It's almost like a stigma. In the UK, if you ask many senior colleagues, they'll tell you, oh yeah, I failed the exam a couple of times before I passed the exam. That doesn't mean that you're not good. We're talking about competing, with quite, highly qualified people that have studied quite a lot, very committed. So failing the exam is basically one step towards getting more experience. So if you ask most of us, I failed the refraction exam when I did it once, and it didn't mean anything. It just made me more determined to go and sit the exam again. So that's one of the messages I want to give to everyone. Second thing is, I think if you look at, we talk about the Greek colleagues who are in the UK, and I've met quite a few. Yes, I will agree with all of us. I think we say we have quite a very good level as well. But also there's one thing, it's determination. So I've also seen people who came to the UK, stayed for 6 months, they said, well, it's not for me. So all the people who are sitting in the panel, and many of the colleagues I see down here, in the audience, one of the things that's common is if you're determined and if you're focused, you will do it. I think that's one of the messages. So yes, the system is quite tricky and it's difficult in the UK. There are more opportunities now because despite of the Brexit, as Mr. Alafi said, as Mohammed said, there are openings, especially for fellowship posts. In my department, we've had Greek fellows. They are very high standard, and they are determined as well, and they work very hard. Yeah, if I need just to summarize, sit the exam if you can. UK is a great place for training. It's very structured. It gives you lots of opportunities. You have quite a lot of supervision, and because the standard is very high, you want to tend to do the same. They say that we are the average of the 5 or 6 people that we are around. So if you're around an environment of excellence, then you have 2 options: you either follow or you don't. And if you follow, you will manage. So yeah, this is what I've had to say. And thank you very much once again for giving me the opportunity to.
Thank you so much. Success stories, one after the other. Thank you. That's that from me. So I think for the sake of time, we're 9 on the mark.
Yeah. Mohammed, if you permit me, tomorrow, Mohammed and Dylan, for people who are interested to have more information, they're going to be around 3 o'clock, Mohammed? So
yeah, that's fine. Yeah.
3 to 4, 3 to 5. Residents or young colleagues who want to have and ask questions, 3 to 5 at the where you want to meet, just at the secretariat.
Yeah, we follow what we're told.
Ας πούμε στη γραμματεία 3 με 5 αύριο το απόγευμα, νέοι άνθρωποι και νέοι συνάδελφοι που σήμερα δεν μπορέσανε, δεν τους αφήσανε να έρθουν. Και το τονίζω αυτό, δεν τους αφήσανε να έρθουν και είναι κρίμα αυτό που βλέπω σήμερα. αν μπορούν αύριο να πάρουν και άλλη πληροφορία. Ο δρόμος είναι ανοιχτή για όλους. Όλοι πρέπει να έχουμε ίση ευκαιρία, και αυτοί που έχουν και αυτοί που δεν έχουν και αυτοί που δεν έχουν τη δυνατότητα να έχουν όλη την πληροφορία. Πάντως, όλοι έχετε τη δυνατότητα να κάνετε καριέρες αυτά τα παιδιά εκεί πάνω, και θέλω να δώσω ένα χειροκρότημα για αυτή την σπουδαία ομάδα Ελλήνων του εξωτερικού. Και να ξέρετε οι νεότεροι ότι μπορεί και εσείς να γίνετε εύκολα ένας από αυτούς. Να μην διστάσετε ποτέ. Σας ευχαριστώ πάρα πολύ. Thank you very much, Mohammed.
I would just like to say thank you for the Hellenic College on behalf of our Royal College of Ophthalmology. Thanks to you and the great work that you're doing promoting the college work and the exams, and we've become partners, and we're very pleased to be with you today. Thank you
very much. Thank you very much.